Hello there, good evening. We're going to talk about the basic structure of OET. I mean, what do you need to know before you proceed with the classes? There's going to be your observation in a while. So before that, I'll clarify what it is so that you understand what is going on in the class. All right. So let's begin with the expressive skills. The expressive skills consists of two parts, like any language examinations. Um, Going to be writing and speaking, right? The way you express yourself. So it's writing. Let's talk about writing a little bit, and then we'll go with speaking, reading, and listening. Let's increase the size. Here we go. Writing. So it is 5 plus 40 minutes in total. There's a reason why I've used plus there, because the initial 5 minutes that you have, this is specially given for you to read the case note. It's for reading the note, right? So in OET, it is called case note. You will see that after I show you what it looks like. So you have to read the note, you have to read the case note. Why is it called a case note? Because it gives the details of the patient's medical background. That's why it's called a case note, not a question paper. So 5 minutes reading time, so you'll not be allowed to use any writing devices, and pencil is the only one that is permitted. So yeah, pencils you can't use. Then we have 40 minutes. This one's this is your writing time. That is the time that has been given to you to approach the case note and convert that into a letter. So what comes in OET is you have three types of letters that comes in OET. The types, they're going to be number one. The first one is going to be a referral, right? A referral letter. Wait, oh goodness, yeah. Then we have, wait here. Number two, we have your discharge. Then number three, we have your transfer. Forgive the capitalization, doesn't matter. So referral, discharge, and transfer, the most common type of letter that is asked in OET is going to be a referral letter. Then we have a least common, that is discharge. Let's say 1%, 2%. It's been a while, they haven't asked any discharge letter yet. It's been 5, 6 months. Then we have a transfer letter when the patient is moving from one place to another. So it's very important to understand what is the meaning of referral, what is the meaning of discharge and transfer. Obviously, since you're a nurse, you know what is the meaning of referring a patient. You refer a patient to seek expertise when the patient is not getting optimum care or not getting any betterment. The patient doesn't get better under your care. That's how you seek somebody else's help. That is called a referral letter. So basically, if you are a nurse, you're writing a letter to somebody else for better care of the patient. That is going to be a referral letter. Then we have discharge letter. What is a discharge letter? So that means when the patient is admitted in a hospital setting and is returning back to where the patient comes from, that is going to be a discharge letter. So after the patient has spent, let's say, 5 days, 6 days, 3 days, 2 days in hospital, and then gets better, and then we send the patient home. Then we have a transfer letter. Transfer letter usually means it's a continuity of care. Well, what do I mean by this? Let's say somebody came to visit a city. For example, somebody came to Kathmandu, let's say to meet their daughter or something. And then the patient got sick and went to the hospital, went to Beer Hospital, and it turns out that the patient has cancer. The patient was operated, but the patient is not going to remain in Kathmandu forever. Is going to go back to the place where he or she belongs to. So the doctor of the beer hospital or the nurse of a beer hospital writes to, let's say, Butwal, to another oncologist or somebody who takes care of the cancer. That is called a transfer letter. So basically, the patient is changing the city. That's going to be a transfer letter. These are the three types of letter that's asked. Of course, there's a format of these letters as well. It's a common format. I'll show it to you in a while. And in the observation class, you're going to understand more about this. But just remember that there are three kinds of letters. In OET, the most common one is referral, then discharge, and then transfer in the descending order. Right? After that, we have speaking. I'll show you what the case note looks like in a while and speaking. Very easy. You are a nurse. So what does a nurse do? The nurse talks to a patient in a clinical setting. So in the exam itself, you do the same thing. You talk to your patient. So when you go to the examination center, your not examiner to be exact, that's going to be your interlocutor, somebody who pretends to be the patient, is going to talk to you. He or she is not going to assess your speaking, but is just going to aid and help you with the conversation. So you're going to talk to the patient on the examination day as well. So there are two tasks in total. Let's talk about it one by one and then you'll understand. So 3 minutes, this initial 3 minutes, roughly you see 3:35 and 35, that's 20 minutes almost. 19 minutes to be precise, but 20 minutes. So initial 3 minutes, this is going to be a warm up. They ask you for your passport, they ask you to sign here and there, they ask you to check your details, names, surnames, and blah, blah, blah. That's going to be a warm up. After that comes your prep time, preparation time, right? They give you a card. It's called Q card in OET. You just check that card, you prepare that card. I'll show you in a while, but just understand. And then we have speaking time, actual speaking, right? This speaking actually is going to be recorded and then it'll be evaluated later by somebody else, not the interlocutor on the examination day. After this one's over, they'll give you another cue card, another question. It's not exactly a question, but a script. Again, that'll have a prep time of 3 minutes, and then we have 5 minutes. This is going to be your speaking time. So in total, two tasks, and it's going to be 20 minutes. What you do on the day of the examination, just talk to the patient. That's it. That's what you have to do. That's what you're supposed to do, right? Okay, all right. This is the speaking part. After speaking, we have reading and listening. These are your receptive skills, not expressive skills. So you have reading. Reading is, let's say, 15 plus 45 minutes in total. So there are three parts, A, then we have B plus C. So A is going to be your 15 minutes. You will have 20 questions. And then B and C, that's going to be 45 minutes. And you will have six plus um, C will have 8 and 8. 8 questions. So in total, so B part will have 6 questions and C part will have 8 and 8 questions. That means there will be two extracts to read from or two texts to read from, right? So in total, 42 marks, so 42 questions. And out of 42, you get 30. This is going to be equal to your B band, and that is actually, that translates to 350. So 350 means B band means 350, and 30 means B band, and 30 also means 350. So you can use them as synonyms. So you're expected to get 30 out of 42, and you get a B band, right? So let me also tell you that all the professions that are permitted to give this examination will have same reading and listening. Only the writing and speaking will be different. So you need to know that. So don't be alarmed on the examination day or while practice that you will see there will be readings from other professions as well. So dentistry or maybe physiotherapy, maybe occupational therapy, optometry, maybe, yeah? Just giving an example. Now, part A is of reading and listening both will be handwritten. So you're going to write with your own hands. And part B and C will be your what is it called? Multiple choice questions, like the way you used to do in Nepal Nursing Council or Nepal Medical Council examination. You just shade, make circles, that's it. So total 42 questions, 30, and you B and C is going to be multiple choice, and A will be handwritten, right? After that, let's talk a little bit about listening as well. It's very important to compare the listening with the reading. There will be some videos that will be sent to you later once you plan to begin the course. You need to watch them and you'll get more in details, and then you'll understand more. Anyways, there is going to be an observation for you later so you can understand more about it. Here, after this, we have here go listening. Right. Listening also has part A, has part B, and also has part C. Right. Here, it's not going to be separate. All of them will be like around approximately, let's say, 55 minutes. Right. So part A has like this 12 plus 12 questions. Right? That means there will be two tapes that will be played to you. Then part B is similar to reading, where there will be 6 questions. Yeah, 6 MCQs. Right? And then part C will have again how many? 6 plus 6. 6 plus 6. That also is going to be that's 12 MCQs. Right? So in total, you get again 30 out of 42. That's going to be equal to B band, and that is going to be equal to 350. So this is the whole story of listening. All right. You don't need to know after
So
you
what
see
were
the
the
class,
options?
after you observe, after you practice by yourself, you'll understand the format. Just know what is there, and I'll show you what it looks like. So let me show you what will the reading, listening, speaking, and writing look like. So here you go. This is the first one I have in my hands, so you can just check it out. So this is what it looks like. So I'll show you an easy one. This is the patient card. So you're not the patient, right? Professionally, you're a nurse, you're a doctor. So you don't do the patient part, but you do the nurse's part. So this is a role player card. It says at the top, you see, that's a role player card number 26. What is the meaning of role player? So somebody on the examination date is going to be a role player. So you are not permitted to see this. This is your card, nurse's card, right? This is your nurse's card. You see? They give you a script, a little bit of background, and then these are the tasks that you need to achieve. The first one, what does it say? This 30-year-old parent is concerned about his her child's forearm, which appears broken. The parent wants to know about the treatment and if the fracture will affect future growth. Somebody comes,
Sir,
yeah,
सबै नर्सिङको क्वेसनहरू मात्र आउने हो कि लाइक नर्सेसहरूको लाइक रिलेटेड विथ जस्ट रिलेटेड विथ नर्सिङ कोर्स मात्र त हुने होइन सर ओइटी त
yeah, it's for nurses and doctors. There will not be anything else. Of course, they will check your medical language. That's it. Um, it's very, very simple here. Just uh, check it out. So here, the story is that a parent comes with a child whose forearm is broken. So you need to counsel the patient. That's it. So in a real life scenario, so if you are in a clinic and somebody comes, how would you talk to a parent? This is what is given. The hints also given. This thing that you're seeing in front of your screen, this is called cue card, and this will be printed in a printed form in your hands all times throughout the 5 minutes that you speak. So you can even read and speak. Not going to be a big problem here. So after this one's over, they give you another one. That'll be a different scenario. So here you go, another one. This is another one. This is a story of a person who was admitted in the hospital, um, has COPD, and the patient is a smoker. She cannot quit smoking, and you have to convince the patient to quit smoking, and you're going to tell ways in which a patient can quit smoking. So the task is also given to you here. So you add something to it, expand these tasks, and then you talk to the patient. Of course, there's a certain way in which you talk, which you will hear later in the class and you'll know. So 2 tasks in total with speaking, and then you have writing. Writing also, I told you, referral letter, discharge letter, or transfer letter. Just see one of them and you will understand what I mean. So here you go. This is the referral letter that we have here. So this is a case note. It is not a question paper. You see, they read the case note and complete the writing task. So they give you the background. Harry Kovacs is a 5-year-old boy who is the son of one of your newly referred patient in the community mental health center, where you are the mental health case manager. They tell you your designation. So these are the details of the kid, the Harry Kovacs, 5 years old. Date of birth is given, school, kindergarten, religion, everything is given there. Now diagnosis. Mother, major depression with psychotic features. Son, early onset separation anxiety disorder. That is the diagnosis of the child. That's the mother's name also given there at the top, Elizabeth Kovacs. Then you have a family psychosocial history. So what happened in the family? So apparently the mother committed suicide, or yeah, tried to harm herself, but eventually ended up in the hospital. And the kid got separated from the mother for a considerable stretch of time, and started developing separation anxiety and social issues. So that's the thing given here. I'm just summarizing it for you. And then we have, because we're going to talk this one in a while in observation as well, so you'll get more into details. Medication, nothing. So whatever we have done, what is the problem with the kid is it's given here. The kid doesn't go to kindergarten, doesn't talk to anybody because of the issue with the mother. A referral plan. So when you refer the patient to a clinical psychologist, these are the issues. And you refer to early childhood mental health team for assessment and management of Harry's early onset separation anxiety disorder. Request joint meeting with the case manager and Elizabeth. So basically, what you're requesting is that the mother and the son and the case manager and the psychologist, they are going to collectively sit together and talk about the mental well-being of the child. So here, this is the task that has to be done. You are the case manager caring for Harry Kovacs's the depressed mother, but due to his psychological issue, need to write a referral for him to John Dyer, clinical psychologist on the Bankstown Early Childhood Mental Health team at Bankstown Hospital. So you are the nurse who's taking care of the mother, but you eventually come across the kid and you find out that the kid has some problem, and therefore you need to write a letter to a clinical psychologist who's going to further evaluate the child and address the issues. So this is a referral letter. There are many kinds, of course. You see, there are many, not kinds, I mean, different scenarios, but basically, this is what you have to do. This is everything is related to nursing. Of course, it has to be written accurately in English. Then we have your reading and listening. Of course, well, let's see, here you go, reading and listening. It looks like this. Check it out. I'll just give you an overview later after the classes commence. You'll get more in detail. So check this out. This is part A. Part A has 4 texts, A, B, C, and D, and out of these texts, there will be 20 questions asked. So you see 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. And after 15 minutes, what does it say? The question paper will be collected. So this will be taken away. Then part B and C will be collectively given to you. That will be 45 minutes. And part B will have separate questions. So you see a box here, manual extract effective cold chain. So you read this paragraph and attempt the question. Again, there will be another one, nurse home visit guidelines. You read this paragraph and attempt the question. So you must be noticing that the part A, they are all connected to same topic, but part B, they are all different. The third one talks about guidelines for dealing with hospital waste. The fourth one talks about patient confidentiality. Then next one talks about email from Dental Board of Australia, right? Then sixth one talks about women and dementia and blah, blah. So read the text box and then attempt your question. Part C, you see long paragraphs. It says at the top, right? Text 1, it talks about asbestosis. So you read these things. There is a trick for that. I mean, you don't actually read, but here you have 8 questions related to that. 1, 2, 3, 4, 5, 6, 7, and 8. After this, another text is given, medication non-compliance. You read, attempt, and there will be 8 more questions, right? And that's the end of the reading. So the total time that's permitted will be 1 hour, right? Remember. Then we have our listening part. Let me show you what the listening looks like. So listening will have part A. I've already told you that it has 12 plus 12 questions. It is basically conversation between a healthcare professional and the patient. The healthcare professional can be anybody. It can be a doctor, it can be a nurse, it can be a physiotherapist, it can be optometrist, it can be pharmacist. So you see these are the questions. You'll play a tape and you just listen to the tape and you attempt these questions. It has to be handwritten. So 12 questions here. You see with the tape 1, patient's name is Roy Miller. And the second one is going to be Marsha Samarina. That's the second patient. Then it'll be 12 more questions. So you listen to a tape and you attempt. That's how it works. Now, similar to reading part B, listening part B also has six. You see one, two, three, four, five, and six tapes. And there are three options. You choose from the options. Then comes the big one, part C. There will be the part C will either be interview style or it's going to be a presentation style. This is an interview. You see at the top, you hear an interview with Dr. Matthew Leach. There will be 6 questions per tape. And then there's another one, there will be 6 questions with another tape as well. So that's how it's going to be 42 questions in total. All right. So any questions so far? Of course, they will be taught to you in detail, but this is the general overview of OET.
Sir, and about the listening part, how we will practice the listening one?
Can you speak again? Sorry.
About the listening part, sir, how are we going to practice the listening one?
I can't hear you properly. Can you speak a bit louder, please?
About the listening part, sir.
Mm-hmm.
Listening. So
Yeah.
like you will send us you will send us the materials, or we will just do it in the book.
Yeah, materials, everything will be given to you, obviously. We will put it on the group. There actually is a group on Telegram, and we put it on the group. You just keep it downloaded and you get it printed, and you can start practicing like that. Materials, everything will be covered. It's not a problem. Actually, there's a lot of material available online, so it's not an issue at all.
Mm-hmm. And sir, we have to do the listening part ourselves, like self practice.
No, we do live as well. Of course, we do because it doesn't make. I teach you the basics. After that, practice, of course, is going to be dependent on you. We're not going to do reading and listening every day. Writing and speaking is going to be every day, and then reading and listening is going to be twice a week. Reading Monday usually, and listening we do on Fridays. So you get the idea basically. After certain tricks have been taught, it's quite easy for you to practice on your own. So the number of
Mm-hmm.
sets that you practice at home, it depends completely on you. So it is actually suggested to practice around 20 to 30 sets before you go for the examination. The most important thing is the
Uh-huh.
timing.
And sir, now my most of my friends, they have already started the class. I know, sir.
Yeah.
You this OET test, OET class. So mine will be the first day from tomorrow, right?
Yeah, yeah, you can do it from tomorrow, the first one. Yeah.
Yeah. So today will be my observation day. I know.
Yeah, you can observe the class. There's going start in like 5 or 6 minutes.
Mm-hmm. And then because like most of my friends, they have already started the class already. I think it's been many days, and mine will be first day. So how कसरी चाहिँ मिलाउने त sir? How will you arrange?
What do you mean by कसरी मिलाउने?
Like अनि अब उनीहरू सँगसँगै जानै पर्ने हो कि मलाई फर्स्टदेखि नै क्लास लिनुहुन्छ
There's no
कस्तो
such thing as
टाइपको
first or second. I mean, you're going to do a writing. They are also going to do a writing. You're going to submit the writing. You're going to do the same speaking.
अहँ,
So if you start from task number 3, they will complete the course and you'll come back to task number 1. So it doesn't matter, no matter where you started from. Even if they're doing like
okay.
task number 15, it doesn't matter, or task number 8 or task number 9, it doesn't matter, because you'll start from a certain task and you'll go back again to the same task. So somebody who's on
Okay.
8, they will finish when they're on
Yeah.
20, and after you finish 20, you'll come back again to 1, 2, 3, 4, 5, 6, 7, 8. So it's like a cycle, you know. So
Okay.
it really doesn't
Yeah.
matter.
Okay.
Everybody's
So
new
then
actually. It's only 2 classes they've done.
okay. So like from today I will from today I will observe, and from tomorrow I will be starting the class. And then so tomorrow